you might have on points of contact with the local health districts. I will also mention that there's going to be another webinar that the superintendent's hosting tomorrow to try to answer some of those operational questions. So really the focus of today's meeting is on the school closure guidance for districts and charters around the state.
Well, this is Governor Little. Thank you all for joining us. I wish it was under different circumstances, but thank you for your interest in our children. My job fundamentally is to keep Idahoans safe and look after their well-being. Given the circumstances we have now, we need to do all we can to escalate awareness and preparedness, prepare for the worst case scenario, but we should also de-escalate alarmism. That is critical. We have the good fortune of learning from other countries and other states about what has taken place there, and we have had people working on this since January. But we must prepare our healthcare system, especially the critical respiratory care and our healthcare workforce. Idaho has an existing process where school districts have the authority to first exclude students who are diagnosed or suspected of having contagious or infectious disease. Secondly, they have the authority to close the school with an order from the Department of Health and Welfare or local health authorities. I encourage you all the people on this call and the rest of your partners, to make an informed, science-based decision based on consultation with your local health authorities based on the circumstances in your individual areas. Just like all the other policy things we do in public education, and many of you and I have talked about this, the best decisions are local, using best practices. Children are different, schools are different, districts are different, and communities are different. Just like one size fits all for other educational issues, circumstances are different for science-based disease management. I'll now turn it over to Health and Welfare Director Dave Jepson, who chairs our coronavirus working group. David?
Thank you, Governor. And just to check that you can hear me.
I can hear you. Go ahead, Dave.
Great. Thank you. I just want to make sure we had all the logistical kinks worked out. Thank you, Governor, for giving me a chance to speak here for a moment, and thanks to all of those on the call. And just to reflect what the Governor said, thank you for your commitment to our children. One of the most important and precious things in the state is our children, and for the wonderful work that each of you and your districts do to provide for their education and many other needs that they have in addition to education. We appreciate that, particularly at the Department of Health and Welfare, because we know that a good start on life is one of the best preventative things that can happen for healthy adults that have minimal concerns or issues as a result of that. But I did want to talk about this school closure issue for just a minute. We recognize that you are facing a difficult decision now and in the future as you consider any school closure, but particularly here in the coronavirus situation that we're in. And we wanted to just make sure and encourage you from a public health perspective to really consider all aspects of what that decision impacts and what factors need to be looked at. I know that was copied on the invite to this meeting was a document that had CDC guidance. I would strongly encourage all of you to look at that guidance and read through it. It comes from the best science that's available. It's really helpful in terms of thinking through the various considerations as you think about a potential school closure, and will help you make the best decision possible for your local area. I will tell you up front that CDC and the Department of Health and Welfare's bias is that we would prefer for schools to stay open at this time. And we wanted to just highlight why we feel that way, but again, want to recognize that you have many considerations and many factors that you're thinking about, and ultimately we will support you in the decisions that you make. As I look at the document from the CDC, there's no epidemiological evidence that closing schools actually slows the spread of the disease. We've seen that in other countries that are ahead of us. And so from a public health perspective, there's not a epidemiological reason to do that. there are other things we can do that do slow the spread of the disease, and we won't talk about those here, but that's not one that necessarily has gotten us there. And then the thing that I would just ask you and to encourage you to think about is in that document it lists out things to consider. One of the biggest is really the impact of the workforce, and particularly the impact to the healthcare workforce. We're at a meeting here at the Emergency Operations Center right now for the state of Idaho, thinking about our healthcare capacity, which you've heard the governor speak about. And one of the biggest impacts to that healthcare capacity is the ability for healthcare workers to be able to go to work. And if their kiddos are home from school, that puts a lot of pressure on that system to be able to perform those services. And so that's actually an important consideration. It's well documented in the document from the CDC, and I just would encourage you to read through that document as you decide to make your decision. Also, that document is really well laid out to give guidance for various lengths of time of when a school would be closed and what the purpose for that might be. And so we do know that if a school is going to close, it's much less disruptive if it's closed for a short period of time than if it's for a long period of time in terms of the overall impact to the healthcare workforce and as well as other workforces. But the one I'm focused on here is the healthcare workforce. So really just wanted to make sure that you, as you make these very difficult decisions, and we recognize that they are very difficult, wanted to make sure that you had the perspective from your Department of Health and Welfare and your public health experts from the epidemiological side, and as well as the impact to the healthcare system as you make those decisions. Again, we're positioning those as considerations for school closure, and just want to make sure you have those. Elke, did you want to add anything to that?
Thank you, Director Jepson. I think you did a great job in summarizing that. And as he said, we are supportive of the CDC guidelines for schools. And I'm just going to reiterate the same thing, that we really encourage you to take a good deep dive into those. We do have also on the phone Dr. Carolyn Bridges, who can maybe speak a little bit more about the infectiousness of COVID-19. I mean, I'm a parent as well. I'm getting the same inputs that a lot of the other parents are getting, and seeing the things that are being posted on social media and whatnot. I know you're receiving a ton of pressure. I'm seeing people rallying around, sending in campaigns to get you to close your doors and things like that. But I think there's a lot of support from public health, both state and local, and you have all the local public health district directors on this call to help you walk through that decision making should you need additional support and guidance. One thing that might be something you put in the hopper to consider is just doing maybe short-term closures for disinfecting purposes, things like that can maybe alleviate some of the concerns. But we strongly encourage you to think about not closing for many of the points that the director was just talking about.
You want to hand over to Carolyn?
Yeah, Carolyn, I'm hopeful that you had time to take yourself off mute if you were, and you can maybe jump into that next piece of it.
Perfect. Thank you all. Go ahead, Carolyn.
Hi, this is Carolyn Bridges. I think you've all made great points, and reading the CDC document, I think that they make a lot of very helpful suggestions about minimizing the time that children may be out of school. And I think it's important to remember that although there's still a lot more information that will be coming out from the medical community and others on this outbreak, all the data to date shows very little impact on children. It's actually quite remarkable how few children are included in any of these case series of illnesses. In China, for instance, they had only 6 hospitalizations that they reported in children out of the many thousands. So the concern is the health of children. The information to date really suggests that children are at very low risk. So I think we should take some comfort in that. And I'd be happy to help with any questions, but I'll defer to the Department of Health and Welfare.
All right, thank you, Carolyn, and thank you, Elke, for those comments. The only other comment that I would make to each of you is, again, you face an important but difficult decision, is that just to keep in mind that it is likely, if you make decisions to close for some period of time, at least here for the next period of weeks, it's likely that the situation will be even more challenging, i.e. that there will be more cases that have been identified in Idaho. Community spread may have accelerated. And so as you consider those decisions, you'll need to make sure you have a clear plan of reopening. Again, if you're going to close, we would encourage you for short periods of time, and making sure you have clear plans for when you reopen, how you do that, and how you get to that up to that point. And then I just want to hand it over to Carol Morley, who's the District 2 Public Health District Director. So, Carol.
Thank you, Director, Governor, and Elke. So this is Carol Morley. The public health districts, all being local with you all in your school districts, are here for consulting, for advice, to sit at tables or calls with you all as you are debating and figuring out what's best for your school. We understand that the science is critical in this, and CDC has offered us good advice. We also understand the local issues and the community pressures that you are all in. So communicating with your local health districts, we are here for you to assist in any way that we can. It was stated early that our phone numbers will be coming out in an email to all of you in case you are not directly connected. I know we've had many calls here in District 2 and across the state. Other school districts have already reached out to local public health. So thank you for that. Continue those conversations. We are here again, like I said, to support you as you are making your decision. Thank you, Director.
So unless Governor, you had any other comments, that was really the message that we had from the public health side of things. Thank you, Governor.
Well, Dave, for everybody on the call, I hope that you have that time to consult with the local health districts. The science, you're all educators. The science is compelling, and we have to deal with the best science that's out there. Everything we've done from the get-go, from January when this threat started to arise, to recently, our calls with the administration, with CDC, all of them have been on the best science. Just like I said earlier, places are different, and timing is critical about when you do this. Having the capacity to slow at the right point in time is what I've learned from the experts that we've put together and all the data we've got. So I would hope that you give that sincere consideration. The department, the state board, the local health districts, and health and welfare, we are with you. We're all working together to keep the impacts of this on Idaho as de minimis as possible.
So this is Greg Wilson again. Thanks again all for your patience. I was glad we were able to get everybody on at one with this information. And like I said, we will be doing follow-up both on the operational side of things and then additionally providing you with those contacts, those local public health contacts this afternoon. So be on the lookout for additional information and emails. And we'll also have key points of contact for you on all these different issues. So thank you very much.
That's the end of the call.